Hello, this is a virtual pathology specimen of an example of calcific aortic stenosis, and this is a condition involving the aortic valve. Let's just have a quick overview. Here is the aorta, which is not normal. We can see these yellowish plaques of atherosclerosis, and this is the region of the aortic valve, which again is very abnormal. And enlarging this picture, this is part of the left ventricle, and over here we have the chordae tendineae of the mitral valve. Again, in higher magnification, we can see the atherosclerotic plaques on the intima of the aorta. And for this aortic valve, the valve cusps are thickened, they are fused together, and this is actually the cut surface of the valve which joins this area. We can see this kind of a very fragmented or fractured looking yellowish material, and these are calcifications. Let's turn this specimen around. So this again is the left ventricle. This is part of the right atrium. And we can see the abnormal aortic valve with marked calcification within the cusp of the valve. Let's have a look at another example of aortic stenosis. This is another example, but this time round we are looking from the top downwards. So again, let's orientate ourselves. We have the left atrium in this region. This is actually the aorta. So if we focus on this aorta here, and as I turn it, we can actually see how narrow the aortic valve is, with a very, very, very small opening. And as a result of this increased pressure, the left ventricle often undergoes hypertrophy. So you can see that the left ventricular wall is thickened, and this is because of the increased pressure load on the left ventricle, which is trying to push out blood through a very narrowed aortic valve. And let's look at one more example. Here again, we are looking at the top view and looking downwards, and this actually shows both mitral valve stenosis as well as aortic valve stenosis. So looking at the valve itself, you can see that it's very narrowed and the cusps are thickened and fused together. This actually may not necessarily be due to purely calcific aortic stenosis. It could be due to underlying valve disease involving both the mitral and aortic valves, for example, infective endocarditis. And as I turn this specimen around, again, we can see that the left ventricle wall is much thicker than usual. So this is, again, left ventricular hypertrophy. Let's learn a bit more about calcific aortic stenosis. This condition has other names including fibrocalcific aortic stenosis and degenerative aortic stenosis. This occurs in the older age group and can be due to previous injury from hyperlipidemia or hypertension, so systemic conditions. It can be post-inflammatory. If there has been inflammatory valve disease, it can be degenerative, and also it can occur superimposed on abnormal valves. For example, if the aortic valve has two cusps, hence a bicuspid valve, or if it is hypoplastic. Clinically, the patients may develop heart failure, angina pectoris, syncope on exertion. There may also be conduction defects and maybe potentially even sudden cardiac death. And we would expect to hear a systolic murmur. Grossly, the cusps of the valve are usually thickened, and not only that, they are stiff, they are hardened. And just to show you, this is what the normal aortic valve should look like. The cusps are kind of very translucent appearing, they are soft as well, and they are not fused together. There is also progressive narrowing of the valve orifice, and subsequently this often results in left ventricular hypertrophy. So here is a very good example of left ventricular hypertrophy. All these virtual pathology specimens, they are fully interactive with labels, and you can rotate and magnify them, and they are available free on our virtual pathology resource Pathweb. So you can either scan this QR code or you can click on the link in the video description to register for free. In summary, here is an example of calcific aortic stenosis. This can be post-inflammatory or degenerative in nature, and grossly what we see is thickening of the valve cusps. They have also lost their translucency because of fibrosis. The cusps are fused to each other, and there is also thickening and expansion of the cusps due to calcifications. And in addition, there is narrowing of the valve orifice or stenosis, and this can give rise to left ventricular hypertrophy. There may be concurrent stenosis as well as incompetence because of the stiffening of the valve. Not only can it not open properly, it can also not close properly. Thank you.